All right, so if I could go back in time and discuss some of the challenges with my patients, a huge challenge is compliance. So we're doing an aggressive traditional treatment in the office. Patients were then instructed to do things at home and then come back in about 2-week intervals. The question is, are they really doing it at home? Are they doing it like how they're supposed to do it at home? What's the efficacy on that? And then they come back in 2 weeks, they're expecting good results when they're not really doing the proper amount of treatment at home. And we're moving at a very slow snail pace, and they're expecting results quicker when it's almost like a team effort. Prior to Swift, I found for myself the most effective traditional method was a detailed shaving down of the lesion in the office, and then I would use a phenol or acid type of medication on top, then cover it with like a well-padded bandage so the patient had comfort throughout the day. And then at home, they would then continue that care via an over-the-counter type of wart medication, either a liquid or a sticker type of medicine. And they would do that on a daily basis, change it, Band-Aids, and so forth like that. The traditional method, I was, decent efficacy. We were moving along. There's no time frame of how quick that treatment would be. It just takes a long time, and patients were hanging in there, and eventually we would get to resolution. I would say on average, patients would probably spend on a twice-a-week level coming back about 3 to 4 months, or 5 months on the more aggressive lesions, on the clusters. And even then, sometimes patients would take longer to resolve or even not resolve with that traditional method. So patients coming in with difficult warts, failed treatments, and prior to Swift technology, we would almost do the same thing that we're doing and just hope for a better result. We would keep that care going and just tell the patient to be more aggressive. We would try to be more aggressive, but we really weren't going anywhere. And the only other option after that would be some sort of surgical excision of the lesion. And to me and the patients, that's a big step from going a conservative, traditional or topical treatment to a surgical intervention. We pride ourselves on being a very modern practice in a upcoming, Manhattan neighborhood. And anytime there's a new technology on the market, we're always interested in seeing what's going on. And when we first heard about Swift, we met them at the conference, and things almost sounded too good to be true. And usually in that case, you're a little skeptical of, going forward or trying something, but we always give things a chance, and it's been doing wonders for us, our practice, and our patients, and I wouldn't go back. I would only go forward and recommend Swift to all my colleagues. It's an effective treatment. I've done Swift on family members, and it's an amazing technology, and it really works. So the biggest impact in my practice with my patients, a lot of our patients are working class people, and they don't have time to come in every week or two. They're busy with life, gym, they're constantly doing things. They don't have time to do the daily treatments. And even the ones that think they have time, they forget, they skip a day or two, and it really slows down the efficacy of treatment, and they expect almost like a miracle. So here with this technology, we're able to offer a almost painless technology treatment to the patients. They come back in a month, we do all the work, they hang out for a couple minutes and then go back to their life. There's nothing for them to do. There's no residual discomfort. There's no downtime. They can go to the gym the next day. They could, run 30 miles. They could do whatever they want. And patients want that. They want that ease of treatment where they come in, the doctor does the work, they do nothing, and then they just come back if necessary for a follow-up. There is a concern with patients. Anytime there's an out-of-pocket expense, in my office, I always offer patients a covered insurance comparable treatment. In this situation, the treatment's not comparable. This is way above efficacy of treatment compared to the traditional or insurance covered technology. We do offer it because some patients do not want to pay out of pocket. The patients that do go forward with the Swift treatment are the patients that have literally tried every other attempt. Other doctors spent a year plus treating warts and to no avail. So for them, time is money. it's cheaper for them to pay out of pocket in the long run to get a well effective treatment and be done with it in a short period of time, as opposed to going to the doctor every 2 weeks, paying a deductible, paying a copay. Those things add up also. At the end of the treatment line, you're almost at the same price out of pocket without realizing it. Regarding efficacy of the treatment, it's very highly effective. I would say most of our patients resolve within the standard 4 or 5 treatments. In medicine, I always tell patients there's no guarantees, and there's always outliers in medicine. Other people have other comorbidities, other immunocompromised patients that usually may take a little longer. It's hard to always give a definitive number of treatment plans with a patient, but the efficacy of the treatment is way above traditional. I've had patients that by treating the warts on the foot without treating the hands, the wart on the hand has disappeared or completely resolved. And that just proves that the immunotherapy response from the Swift is highly effective. Since we have brought Swift into the office, we have seen a lot of personal referrals from patients to their coworkers or family members. It's like an eye-opener, this treatment. Patients have really schlepped along doing the conservative care at other places, and when they hear about the Swift technology, they're amazed about how easy and efficient it is, that they wonder why they wasted so much time other places and going nowhere, where they come in, we do all the work, in a few minutes they're done with the treatment, and then they go back to reality. I've had patients literally tell me they've searched up for a more convenient way of treating this, where it doesn't interact or affect their daily work life, and they could come in on a once-a-month level, where patients flat out said that I don't have time to do things every day. I don't have time to come back every 2 weeks. It's just, I started a new job. I can't leave work. I can't go here. This is a way more effective way of treating it on a once-a-month level. So on a personal level, I really care about my patient and always want to give them the best treatments. With the Swift technology, I'm able to honestly tell them that we have an answer for their problems, that we can quickly resolve their stubborn warts and efficiently and without any extra homework to do at home. It gives us that ability to offer this to the patient and really help them, and as a sole practitioner, that's a huge accomplishment that we could really help our patients. So regarding IPKs, in the world of podiatry, there's really no direct or definitive treatment for an IPK. Those are also a very stubborn thing, and quite often the doctor doesn't have a real answer for the patient of how we treat those, how long they'll take. With working with Swift and the company, they've been amazing. We've recently started doing trial treatments on patients for IPKs, and again, same method of zapping the patient. They come in on a once-a-month level and doing nothing in between. Patients in the trial have shown a significant decrease in pains within a short period of time, significant reduction of clinical appearance of the lesion, and also an increase of quality of life, that they're able to go back to sports and other activities and don't feel anything on the foot anymore. And we're hoping with the Swift technology that this will become a long-lasting treatment in the realm of IPKs, and other doctors can offer it to their patients. So if you're really struggling with difficult or stubborn warts, have tried other methods, or just had a new wart that came up, I highly recommend coming into our office. I'm Dr. Raphael Lilker, foot doctor of New York. You can find us online at footdocny.com. We're a very modern office. Everything's computerized. You can book online via our website. You could call us up and we'd be more than happy to answer any of your questions. But I'm really happy to offer this to my patients in my practice, and we look forward to helping future patients as well.